Hey, welcome to another episode of Sex Ed with Mel in 30 minutes or less here at Jefferson County Public Health in Jefferson County, Colorado. So today, this month, we're going to talk about STDs, which stands for Sexually Transmitted Disease. You'll also hear it referred to as sexually transmitted infection, and it means the same thing. What sexually transmitted disease, or STD or STI, refers to is an infection that is passed through sexual contact. And so when we talk about STDs, there's a few different types. So there's STDs that are caused by bacteria, STDs that are caused by viruses, and STDs that are caused by parasites. We'll go over them all, nitty-gritty. And then also when we talk about STDs, there is curable versus treatable. Now what curable means is that once you've been diagnosed with the STD by your doctor and you take the medication as directed, then you're cured. You don't have it anymore. You might get the infection again if you're exposed a second time, but for that instance, you'd be cured. And then there is the kind of STDs that are just treatable. And what that means is once your doctor diagnoses you and you take the medication, your symptoms may be under control, but you may continue to have this infection for the rest of your life. So it can be kind of a heavy topic sometimes, but it's important to know that there are ways you can keep yourself safe and protected while still managing to have, a healthy sexual life. So the first type of STD that we're going to talk about are STDs that are caused by bacteria. STDs that are caused by bacteria are curable. So that means, again, that once you take the medication as directed, you don't have the infection anymore, as long as you're not exposed a second time. Two of the most common STDs that you'll hear about are called Chlamydia and Gonorrhea. Both of these STDs are bacterial, and they are passed through fluid-to-fluid contact. What that means is that these bacteria live in a partner's sexual fluids, so either the male's ejaculation fluid or women's vaginal fluids, and then the exposure of that fluid to another fluid, or really the slippery, wet tissue that is the inside of someone's genitals, whether that's the male penis or the female vagina, and the passage of the bacteria that way. And these two STDs are pretty similar in that they can have no symptoms at all. You can have an infection and not even know it, but also you can have symptoms too. Symptoms for chlamydia and gonorrhea are pretty similar. Whether in men or women, some common things that you might notice would be uncomfortableness with urination, so it's painful or it itches. Unusual looking discharge, whether that's color or smell, is also not uncommon, and neither is pelvic pain. But if these STDs are left untreated, then it can actually travel upwards into the higher parts of the reproductive anatomy, so the women's fallopian tubes or men's testicles, and it can cause scarring, and it can actually make it very difficult to either get pregnant or cause a pregnancy later on down the line if they're not treated. But the good news is that once you've been treated with these ones, you're cured as long as you take it correctly and your partner gets treated also. Another type of bacterial STD is called syphilis. And this one's a little bit different in that it's not fluid to fluid the way chlamydia and gonorrhea are, but syphilis is actually spread through skin to skin contact. When you have a syphilis infection, there's 3 stages. The first stage is kind of this ulcer, it's kind of like this little blister looking thing on the skin, except it's kind of indented and it looks really gnarly, but it doesn't hurt. It's just kind of there. And eventually it may go away by itself, and you may think you're fine, but you're not, because the bacteria is getting into other parts of your system, and then those types of sores may start appearing on other parts of the body. And if left untreated for many years, syphilis can actually progress to where it may affect your nervous system, so your body's ability to think or control the way it moves. So syphilis can be detected with a blood test, so that one's nice and easy. And the medication for that one is penicillin. So if you had ever got syphilis, you could rest assured that as long as it was treated early enough, that you would be cured. The next type of STDs that we're going to talk about are caused by viruses. These ones are different from the last ones that we talked about because STDs that are caused by viruses are not ones that are curable. These are ones that are treatable. So it means that you'll continue to have the infection for the rest of your life, but there are medications and treatments available that can help to control the symptoms and your infectivity. So the first type of viral STD that we'll talk about is called the human papillomavirus. You might have also heard of it as HPV, which is what HPV stands for, is human papillomavirus, or genital warts. It's the same thing. HPV, there's about 100 different strains of it, so there's about 100 different types. Only about 40 of those 100 will necessarily cause symptoms. And some of them will cause genital warts, and some of them will cause cancerous changes to certain types of cells in the body. So if you've ever heard of a pap smear, or if you've ever had a pap smear before, if you're a female-bodied person, then that pap smear, what it's doing is looking for cancerous cell changes that are caused by an HPV infection. HPV is something that the more we learn about, the less it turns out we actually know. Sometimes with this one, it is possible for the body to kind of kick the infection by itself and for symptoms to go away on their own. We're not sure if that means it just is lying dormant, where it's still there but not really causing any issues for a long time, or where people might just be carriers where they've been exposed to the virus and they don't have any symptoms, but partners that they come into contact with may then later develop those warts or those abnormal cell changes that we're looking for. HPV can be treated if it's a genital wart type, then those warts can be frozen off or treated in a doctor's office with medication the same way that warts on your hands or your feet might be treated. And then if it's a bad looking cell change, then there's appropriate treatments for that where we're taking just those pieces of those abnormal cells off. With HPV, there's actually a way you can protect yourself, and that is to get the vaccination called Gardasil or Cervarix. Both of them provide you with immunity against 4 of the most common strains of HPV. So 2 that cause the most genital warts and 2 that cause the most cancerous cell changes. Now remember, there's 100 different types and 40 of which can cause symptoms. So it's not 100% protection, but it would be a good idea to get if you're interested in protecting yourself from HPV. So that's one type of viral STD. Another type is herpes, and there's two strains of herpes, Herpes Simplex 1 and Herpes Simplex 2, so HSV 1 and 2. And with Herpes Simplex 1, what you'll see are these blisters that are usually just one blister at a time, and a lot of times you might see them on a lip because it's a cold sore. It's the same thing. Whereas a Herpes Simplex 2 tend to crop up in clusters of blisters, and they're typically much more painful, and they may reoccur the same way a cold sore does. And typically it used to be that we would just see Herpes Simplex 2 on the genital area, but it is possible for Herpes Simplex 1 type blisters to later appear on the genital area if there's that contact between oral to genital, where that may be passed, because like HPV is, it's that skin-to-skin contact that passes this type of STD. With herpes, it is one of those things where you would have the infection for life if you did have it, but there are medications that can help to control outbreaks. And a lot of times with herpes, whether it's 1 or 2, a person may only have 1 outbreak in their life, and that's it. That's all they ever see. But they may still be able to carry the virus. But if the medications are taken correctly, it can definitely help to reduce the number of outbreaks, or if just taken during an outbreak, to lessen its severity. If you or a partner had herpes, you would want to make sure that you're not being sexually active when there's active blisters, because that's when you're at the highest risk for passing that infection on to other people. So a third type of STD that's caused by a virus is HIV. Human Immunodeficiency virus. And with HIV, this one is passed through that fluid-to-fluid contact. HIV as a virus lives in the body's fluids. So it can live in blood, it can live in semen, it can live in vaginal secretions, and it can also live in breast milk in women. And the way it's passed is through exposure to those infected bodily fluids. HIV is not, as awful as we thought it originally was, when we first figured out what it was in the 1980s. Medications and research have come a long way to where even if someone has HIV, they can live a long and healthy and active life as long as they're following their doctor's recommendations and taking medications as needed. What HIV does is it attacks the body's immune system, and so it makes it so that it's very hard for the body's immune system to fight other types of infections. So infections that may cause problems but that may not cause problems in regular healthy people. So what would be like a normal cold that lasts a couple days with someone who doesn't have HIV, that same cold in someone with HIV might become very serious to the point where they have to be hospitalized. And with HIV, if it's not treated, it can then progress into what's called AIDS, which is acquired immunodeficiency syndrome. And that's when the body's immune system really just shuts down and isn't able to fight infections very well at all. Since HIV is passed through that fluid-to-fluid contact, the way to avoid getting that one would be to avoid, again, those contacts with those infected sexual fluids. So the third type of STDs that we have to talk about today are those that are caused by parasites. Parasites are a little bit different from bacteria or viruses because they're actually like little critters that are passed through that sexual contact. The first one is called pubic lice. You may also have heard it referred to as crabs. And what it is it's basically the same thing as lice that live in the head hair, except pubic lice live in the pubic hair. And so treatment of pubic lice is pretty much the same as it is with head lice in the use of medications to kill the critters. So to avoid that one, it's pretty much just avoiding that skin-to-skin contact, which can allow those to transfer over. Another type of STD that is caused by a parasite is called Trichomoniasis, also just called Trich. And with Trich, it's basically a little one-celled organism that can live in those sexual fluids, but it's not so much in the fluids as it is the membranes where those fluids are found. And what it does is it kind of just burrows into the tissues and just kind of lives there and causes problems. Sometimes there's symptoms with Trich, sometimes there's not. If there are symptoms, usually what it looks like is that painful urination, is that abnormal discharge, usually green and frothy and appetizing. And a lot of pelvic pain is also pretty common with Trich. But the good news is that STDs that are caused by parasites are curable versus treatable. So as long as you take the medications or apply the medications as directed by your doctor, then you should be okay. Again, you're not immune once you've had it once, not like chickenpox. If you're exposed again, you can definitely get these guys a second time. Okay, so we've talked about different types of STDs, but you may be wondering, okay, there's lots of scary stuff out there. What's actually going to happen when I go into my doctor's office if I want to get tested for these things? Well, let me tell you. So a lot of times, if you're not having any symptoms, your doctor may not necessarily even need to do a physical exam because they may be able to test your fluids for these STDs. A lot of times, again, no symptoms. If you have symptoms, if you've noticed skin changes, if you're noticing unusual discharge or pelvic pain, these are things that your doctor really should examine. So that would be kind of a close-off exam. But if you're not having symptoms and are just going to get just tested just for your peace of mind, then they may not need to do one. But that's a conversation you'll have to have with your doctor because everybody's is different. But ways that we can test for these STDs would include a urine sample. We can test for chlamydia and gonorrhea with a urine sample. We can test for most of the viral STDs. So we can test for HIV, we can test for syphilis and herpes, and then we can with those things we can test a blood sample. So with some of those, it might just be like a finger poke, and we just run a rapid test, or it may be an actual blood draw that we have to send off to a lab. But those are, we can also test that way. For some of these, the best way to diagnose is being able to see the changes to the body that they're causing. So something like that causes those skin changes the way HPV or syphilis or herpes do. The best way for your doctor to diagnose it is to see the skin change as it's happening, and then to be able to kind of swab it with a Q-tip and send that off to a lab to see what exactly is causing that. But if your doctor decided to do an exam for a female-bodied person, what that would look like is just like a regular pelvic exam, up on the table, speculum, and looking at the genitals, and then maybe taking a swab from the inside of the vagina to see what it looks like inside there, because certain infections can cause certain symptoms that maybe only your doctor would be able to see. And then maybe taking a Q-tip, or what's basically a Q-tip, and taking a swab and sending that off to the lab as well. For a male-bodied person, it would probably not be quite as invasive as a female exam. The doctor would be looking at the genitals for those skin changes, and may obtain a sample of discharge if that's a symptom that's happening, and send that off to the lab for analysis. So it's not as scary as it sounds, and it's definitely worth the peace of mind of making sure that that you're okay and you don't have any infection. So what if you're thinking, yeah, Mel, that sounds really great, but man, I just do not want to have that conversation with my doctor, and I don't think I really need an exam because whatever symptoms I had have kind of gone away by themselves. And that's a perfectly natural kind of reaction to have, where maybe like if you have a cold for a few days and then you feel better and want to go to the doctor if you're feeling fine. But the thing with STDs is that they can have symptoms, and then those symptoms go away, but the infection is still there and can still be causing problems to your body, even if you feel fine. So with some of these things, it may have impacts on future fertility, so your ability to get pregnant or cause a pregnancy later can be compromised if you have chlamydia or gonorrhea that's not treated. With other infections, it can even be fatal. If you've been exposed to HIV and you don't know about it, but it's in there and causing problems in your body's immune system, it may be that you're okay now, but later on down the line, your body's immune system can be quite compromised, and that's not good. So even though it may be an awkward conversation to have with your doctor, or you're feeling okay, if there's any question in your mind that you might have an STD, it is important to get tested for your health and your partner's if you're sexually active. So say you went to the doctor and you got a diagnosis of an STD, whatever type that is. Well, now what? Well, it would be important to take any medication that your doctor gives you so that you know that your body is either going to be cured of the infection, or at least so that you can manage the infection. So basically, it would be important to follow whatever advice that your doctor told you, but that's not where your responsibility stops. If you're sexually active with another person, whether that's another man, a woman, somebody of the opposite gender, same gender, any gender, doesn't matter, because when you're sexually active with somebody else, if you have an infection that you know about that's not been treated, or that has been treated, it's possible your partner may have been exposed, and you would need to have that conversation with your partner to let them know that they may be at risk for whatever infection you've been diagnosed with, and that they need to go to their doctor and have an exam or tests done as appropriate. It's just an important piece of respecting ourselves and respecting other people and protecting their health and our health. And ultimately, although it may be a very hard conversation to have, it's definitely an important one to have. If it's a little bit different, where say you've had a diagnosis and it's not one that's curable, it's just one that's treatable, and you're starting a new sexual relationship, it would be important to disclose that to the person you're thinking of being sexually active with, so that they can make an informed choice, or you can talk about those ways that you can protect yourself and definitely reduce your risk of transmission or affecting your partner's health or your own health. So let's talk a little bit about ways that you can prevent getting an STD. Obviously, the most effective way of not getting an STD is by avoiding activities in which you may be at risk. So avoiding the skin-to-skin contact with genitals, avoiding that oral-to-genital contact, avoiding that fluid-to-fluid contact, or if they're bloodborne, avoiding activities where you might be exposed to someone else's blood would all be great ways. So that might look like not having sex with a partner. It might look like, if you're going to have sex with a partner, making sure you both get tested first to make sure that you're on even ground, get tested and treated as appropriate, and then to use things that may definitely reduce your risk. So things like condoms or dental dams. Not sure how to use a condom? Check out our other video. And these things can definitely reduce your risk. They don't take it away though, because there's places a condom doesn't cover, and if it's an STD, that's that skin-to-skin contact, and that's not covered by a condom, then you're still at risk. But condoms really are the most effective way, other than not having sex at all, to reduce your risk of those fluid-to-fluid and a lot of those skin-to-skin kind of STDs. But make sure that you're doing it 100% of the time, because a condom is only good if it's being used and not in a desk drawer. So with that said, this is another episode of Sex Ed with Mel in 30 minutes or less.